Welcome to the Block 3B2, Community and Public Health Practices. My name is Tim Mitnick, and I'm truly honored to be invited to moderate this session today. I'm a registered nurse with a Bachelor of Science in Nursing Sciences from Frankfurt, Germany. Currently, I'm working as a nurse on a general medicine ward, and a project lead on this ward. In terms of my professional engagement, I was previously served as the Director for European Affairs of the European Nursing Student Association and the President of the Student Board of the Florence Network. It's a truly pleasure for me to introduce our two speakers. Because I've known both of them around 4 years now, and over the time I've seen them grow into strong voices in our field, and I can confidently say you are in for a great session here. Both of them are, in the best possible way, are really political foxes. They know to navigate system, advocate effectively, and get things done. Let me start introducing Marlene. Marlene is a registered nurse working in pediatric care in Stockholm, Sweden, and she's actively engaged within the ICN, the International Council of Nurses, through the Nursing Student and Early Career Nurse Steering Group, as well as in the Swedish Association of Health Professionals at the regional level. Alongside her clinical work, she's shown strong leadership in student and professional advocacy, including contributing to the international discussion on climate and planetary health. She represents a generation of nurses who are not only providing care, but also shaping more sustainable and equitable health system. Marlene will introduce herself later more deeply. And then we have also Francisco here. For me, this introduction is also a personal one. I can truly say it's an honor to call him not just a colleague, but also a friend and a role model. Francisco is a registered nurse from Portugal, currently pursuing Master in Health Management. He has been strongly involved on the European level, including through the European Nursing Student Association, where he served as president. He's also contributed to international discussion connected to the World Health Organization and the International Council of Nurses. His work bridges education, leadership, and policy with a clear focus on strengthening health system through collaboration. That was a short introduction to both of our speakers. I'm sure that they will speak more about themselves. Before we start this session, just a quick note to the flow. I'll be collecting your questions through the session via chat, and we'll come back to them once both speakers have finished their talk and we can discuss them. And although I introduced Marlene first, we will actually start with Francisco, as he's currently working, and there is always a possibility he might be called for an emergency. So with that, Francisco, the floor is yours.
Thank you, Tim. Thank you for your presentation. So, first of all, thank you. I want to thank the Nightingale Initiative for once more and 1 year more to invite me to this kind of webinars. It is the second time, so I'm glad that I've been invited once again, and I'm always open to any collaboration and to any possible future initiative that this initiative or others might have. So, good afternoon, everyone. It is a privilege to join colleagues from around the world, especially Tim and Marlene here in this discussion, in this important conference dedicated to planetary health. I'm honored to contribute or trying to contribute to a European perspective on how nurses can lead practical solutions within public health and in our communities. Across Europe, we are witnessing the rising temperatures more frequent. But before I'm going there, wait just a second. Tim introduced me, so there is no need for me to go further. But for those who don't know me, I was the former president. I'm the former president of the European Nursing Students Association for the past term. I've been in the association the last 2 years, the first one as the research officer in Tim's European Affairs team, and then I became the president for the last year. Right now, as you can see, I'm working, so this nurse life always is surprising us. I was supposed not to be here in the hospital, but the duty called, so I have to be here. That's why I'm wearing this jacket. Right now, I'm serving in the Young Nurses Council of the Portuguese Order of Nurses. And I'm also pursuing a master's in health management in the National School of Public Health in the Nova University of Lisbon. Basically, this is a sum up of what I'm doing right now. And these are some milestones that we achieved. I always like to, in these kind of forums, to remember the milestones that we achieved in the last 2 years. As you can see, and this is just some milestones. We achieve a lot more. But as you can see in the photo, in the right photo, in the bottom right, it was in the WHO Regional Committee of the WHO, where for the first time nursing students could speak about student engagement. So, from crisis to community action, how nurses can lead planetary health in Europe. That's what I called for this speech. So across Europe, we are witnessing the rising temperatures, more frequent heat waves, worsening air pollution, floods, droughts, biodiversity loss, and increasing pressure on health systems. But these are not isolated moments or isolated environmental problems. As we all know, they are health problems, they are nursing problems, and they also are community problems. Every summer, emergency departments receive more frail, older adults affected by dehydration and heat stress. Every winter, poor housing and pollution worsen respiratory diseases. Floods disrupt medication access, transport, and continuity of care. Anxiety about the future increasingly affects not only but especially young people. And this is already our present. This is already our daily practice. This is exactly why nurses and nursing should be part of the solution. Why this should be a public health priority? First of all, human health depends on clean air, safe water, nutritious foods, stable climates, and health ecosystems. When these systems are disrupted, our health suffers. The World Health Organization estimates that millions of deaths each year are linked to avoidable environmental causes. Climate change increases cardiovascular and respiratory illnesses. Pollution worsens asthma, COPD, stroke, and cancer risk. Biodiversity loss threatens food systems, mental well-being, and infection disease control. In Europe, these risks are intensified by demographic aging. We have older populations, many people living alone, high rates of chronic illnesses, and communities already facing social inequalities. So when we speak about climate, when we speak about pollution, when we speak about biodiversity, we are also speaking about equity. We are also speaking about prevention. We are also speaking about resilience, and we are also speaking about justice. This is the language of public health, and this should be our language, the language of nursing. So, what are we seeing in Europe right now? Across the European region, we are already seeing clear health impacts. Southern Europe faces intense heat waves and wildfires. Countries such as mine, Portugal, Spain, Greece, and Italy, we see on the news that we know well the consequences of extreme temperatures. Central and Northern Europe have experienced floods and damaged homes, health facilities, and transport systems. Not only Central and Northern Europe, because I will show you a personal incident here in Portugal as well, very recently. So not only, but especially. Urban areas continue to struggle again with air pollution, especially affecting children, older adults, and people with chronic respiratory diseases. Rural areas may face isolation, reduced access to care, drought impacts, and economic vulnerability. Throughout all these regions, mental health pressures are growing, especially anxiety among younger generations and distress among communities repeatedly affected by these disasters. This tells us something important. Planetary health threats may appear differently in each place, but every community is affected. That is for a certain that we have. And because nursing exists in every setting, in every place, we are uniquely positioned to respond to these causes. And how can we respond to that? What are the strategies that we should implement or should try to think about it? Here, I'm not saying what is wrong or what is right, okay? The intention of my presentation is for all of us to think about it, okay? So I bring here some strategies that we can start to think about it, okay? So the strategy number one, heat wave preparedness and protection of vulnerable people. One of the most immediate climate threats in Europe is the extreme heat. The summer is approaching. So this heat, as I mentioned before, affects older people, older adults, people with heart failure, respiratory diseases, diabetes, cognitive impairment, and people living alone. Nurses can lead heatwave preparedness through simple but I think powerful interventions. First of all, identifying high risk individuals before summer periods. I think, especially in my reality, I think we have sometimes we don't prevent, we just act when everything happens. So we should take accountability and we should identifying these risks before the periods arise. Community outreach, phone calls during heat alerts, home visits for vulnerable patients, hydration education, medication review when appropriate and when needed, when the people need it, advice regarding cooling strategies and warning signs, and coordination with social care and local authorities. So, among all of these interventions, you can see that we can have an impactful role, at least in this first strategy. Then you can tell me if you agree with me or not. So, as I said before, many hospital admissions during heat waves are preventable with earlier intervention. This is where we should, and this is where nursing changes the outcomes before crisis happens. So, we must move from a reactive emergency care to a proactive seasonal prevention. Strategy number two, tackling air pollution through prevention. Air pollution remains one of the largest environmental threats to health in Europe. It worsens asthma, COPD, coronary diseases, strokes, child development outcomes. So, how can we play a leading role by integrating pollution awareness into a routine care? So, by educating respiratory patients on symptoms management during poor air quality days, promoting smoking cessation, supporting vaccination programs, encouraging active transports when it's safe, helping families reducing indoor pollution exposure, and identifying communities disproportionately affected by traffic or industrial exposure. In primary care and in community settings, nurses can transform air pollution from an invisible risk into an understandable and manageable health issue. This is prevention in practice. Strategy number three, nature-based health promotion. Sometimes solutions are not only technical, they are relational, they are environmental. Access to green spaces, safe walking routes, parks, community gardens, and social connection improves both physically and mental health. Maybe for some of you, this is part of your daily routines, but for example, in my area and in Portugal, for example, we tend not to take the most advantage of these green spaces, safe walking routes. We don't have yet this mindset. So how can we support? Walking groups for older adults, outdoor activity programs, social prescribing, gardening projects, for example, for recovery and well-being, and community engagement initiatives. These interventions, of course, as we all know, will improve cardiovascular health, the mood of the people, mobility, and social well-being while reconnecting people with nature. And finally, sustainable healthcare starts with everyday practice. Healthcare itself as an environmental footprint. Therefore, health systems must protect health without harming planetary systems. And we are also, again, central to this transition. And how? Some examples can include reducing unnecessary waste, rational use of materials, smarter stock management, energy cautious workplace habits, supporting sustainable procurement, and quality improvement projects with environmental outcomes. This maybe at the first sight should be like easy, but I wanted to address, and I think it's always nice for us to go again to the smallest points, if you allow me to describe like that, to then we can make an impactful to have impact. Okay. So among all of these, I brought also something that I think is really, really, really important for this discussion. Among all of these challenges, we also have another one for our education. If we are witnessing a change in our health systems, I believe personally that our education also must change. And how can we do that? Um, First of all, nursing education is itself is already changing. I think it's a reality. Slowly, but I think we are changing. We are changing. And then we cannot prepare tomorrow's nurses, and I cannot, as a nurse myself, I cannot prepare myself for the future to continue to work in the next 40 years. Um, if I'm not preparing the future, you know. So we need to prepare future nurses not only to bedside care, but also to complex systems, to this uncertainty, to prevention, to disasters, to sustainability, to digital innovation and community resilience. This means our nursing curricula should increasingly include planetary health and climate health connections, disaster preparedness and emergency response, public health leadership, health inequalities and environmental justice, sustainable and clinical decision making, interdisciplinary collaboration, data literacy and innovation, community-based prevention models. This vision is strongly aligned with the recent International Council of Nurses Student and Early Career Statement, which calls for planetary health to become a core component of nursing education and for curricula to reflect the realities of the climate crisis. This statement, I don't know if Marlene will talk a little bit more about that, but this statement also reminds us and reminds us that student and early career nurses are not only the future professionals. We are already essential contributors today with valuable insights for education, practice, policy, and innovation. Um, but with that, clinical excellence remains essential. Today, this excellence, I think, also means adapting to these new systems, systems thinking, and leadership. And I think this leadership is really important because we cannot move further, and we cannot our profession cannot take the next step if we don't take accountability, and we don't have leaders to step up and to talk about these problems, and to for the decision makers to really see that we can shape the systems, and we are really important, not only the decision makers but also the communities itself. The communities should feel that we are influenced, and that we have a really value contributes in their lives. So the classroom and the student perspective must reflect the world our students are entering, because if the healthcare is transforming, education cannot remain the same. Right now, and if you allow me, these are all images from my hometown, the town that I live. And this was two months ago, actually. And if you allow me, I brought here a personal reflection from Coimbra, where I live. So here we recently severe flooding caused the river to overflow, as you can see in the picture, where homes were damaged, families were displaced, and many people suddenly lost the safety and stability of their daily lives. In those moments, what stood out was not only the force of the disaster, and it was really, really huge. I don't know if you hear the news, like international news, or if these events broadcasted in your countries. But we got hit really, really hard here in the central region of Portugal with these heat waves. Heat waves, no, floods, sorry. Um, and what happened? Nurses came together quickly to support people shelter in the sports hall, and you can see in the bottom, in the upright picture, and temporary accommodation centers. I was one of them. We provided clinical care, emotional support, medication management, health assessments, reassurance, and dignity during a
Um,
moment of uncertainty.
Francisco, sorry to interrupt, but you need to
We
wrap
need to.
up, like you have like
Okay.
2 minutes.
Yeah, okay. So this was just to show that what nursing looks like in during planetary disruption. It is competence in crisis, it is compassion under pressure, and is organization when systems are strained, and is humanity when people need the most. Could continue talk about more about this situation, but I'm going now. So, to conclude, how can we truly make an impact? And this is where I challenge all of us with some questions. So, and for the audience, how do we move from inspiring speeches, as I'm doing right now, to measurable change? How we do demonstrate that investing in nurses reduces heat-related admissions, for example, in the summer? How do we prove that nurse-led prevention lowers respiratory exacerbations linked to pollution? How do we measure the value of trust, reassurance, continuity, and community presence? How do we ensure environmental sustainability becomes part of the quality indicators in healthcare systems? And perhaps most importantly, if nurses are present at every stage of prevention, crisis response, recovery, and education, why are we still too often absent from decision-making tables? These are not rhetorical questions. These are questions that I wanted also to hear from you. And my final message for all of you is next month we will celebrate International Nurses Day. It is a moment to honor our profession that stands beside people in the most vulnerable moments every single day. But it should be a moment of reflection. If we are always advocating for better conditions, greater recognition, stronger leadership, and safer systems, for our profession, then that journey must also begin from within our profession. It must begin with unity, with mutual respect, with inclusion, and with supporting one another across generations, specialities, sectors, and countries. A divided profession struggles to be heard. A united profession becomes impossible to ignore. And social recognition, I think it's the most important, one of the most important things, grows when society truly understands our impact, not only in hospitals, but in homes, schools, communities, disasters, prevention, education, and policy. We are not an expense, we are an investment, and we should act like that. We are not background professionals, we are the ones that can build these systems. So for this Internationals Day, may we stand together, may we lead together, and we must value one another more deeply. Because protecting planetary health is also protecting human health and protecting ourselves. To stronger communities begins when nursing is empowered. So you are allowed to, as well, to okay, so you are allowed to scan the QR code for my LinkedIn. I'm always available if you have any questions. And leading, inspiring, and transforming. It was the final message that we in the ICN Congress addressed, and is the final message that I want to address again here. So happy International Nurses Day for everyone. So thank you.
Thank you, Francisco, for this strong message. And we won't continue talking about it long because we need to move to Marlene, that I'm sure that we share also a strong message and inside information. So Marlene, is to you.
My name is Marlene, and I'm a registered nurse since June of 2024, so almost 2 years. I've been active in the ICN Student Steering Group, like the former version of the Student and Early Career Nurses Alliance. So this is me. Yeah, I've been a nurse, a registered nurse since June, former chair of the ICN Student Steering Group. And I was active in the Swedish Association of Healthcare Professionals as a student. Then I was a president of the student body. And as of now, I'm currently in the regional board of Stockholm. Yeah, and these are some pictures from the ICN Congress in last year. Yeah, and the thing I was going to talk about is, as Francisco mentioned before, when I was in the ICN Student Steering Group, we worked on a call to action, sort of, where we enhanced the focus on why, like, education and students need to be a part of the planetary health, like advocate for these issues that our future is facing. And one of my big things is to work on is to empower student and early career nurses, and how do we focus on planetary health and make it an issue for everyone within our organization. And we, in the regional board, I feel that I have an obligation to kind of have an impact on how we create formal pathways for both students and early career nurses to actually participate in these type of questions within our organization, because the future of they are the future of the nursing. What I was going to talk about was these call to action are what our students are asking for. We released a statement from the ICN why we have to work with planetary health and climate change, and we have to recognize students and early career nurses as essential contributors and not just future participants, but also make like planetary health a core component of the nursing education. which is grounded in ethics and evidence and practice, so that the students can meet the new challenges that we are facing with these climate change. And we have to prepare the nurses to also lead in the transition to be a sustainable and more equitable and climate resilient healthcare system. And I think this statement was a very big step for the students and early care nurses. And I think it's very important that we show how that they get to talk about this and get to also, us as a community can hear from the student side. And I think that we have to also work towards how we can, sorry, I'm getting lost. Well, anyways, I worked with this, and when I graduated and stepped into clinical practice, something very important happened to me. Planetary health wasn't just a concept, it became a context. I work in a pediatric ward. Well, in climate change, here in Sweden, we have not seen yet the most big effects yet, but we already see the effects of the climate change, as such as asthma, exacerbation, infectious disease patterns, mental health distress in children and also families, and how families are vulnerable to these type of changes within the climate. And also, I realized what a big contribute to the climate change we as a profession are when we in the healthcare. We have a lot of single-use products which we need, but we don't have the strategic work to actually implement new and sustainable alternatives. And also we are affected by the governments and what they choose, and we are in that way kind of locked in, and it feels like you can't actually affect your environment in that way. And it's not always we can meet the demands that we feel from 2 minutes left on the, yeah. And yeah, so education is where the change either starts or stalls. Education shapes what nurses feel responsible for. And also as a student coordinator on my ward, I work closely with nursing students in the clinical placement. And what I've learned is that education sends powerful signals about what counts. And if planetary health appears only as an elective, students internalize that it's optional. And if it's disconnected from the clinical teaching, students struggle to translate it into action, which I also feel that I have struggles with, even if I'm very engaged in this question regarding planetary health. And we need to make this a planetary health embedded in the education systems. And therefore, we as, when you're active in nursing associations, we have a very important role in talking to policymakers. Why is this important to us? How can we affect the education, and how can we actually work towards a more sustainable future within the healthcare? And when students are encouraged, if planetary only appears as an elective, they get disconnected from what's actually in their reality. And why do we do things as we do? And how are there more sustainable alternatives? and how can the system affect patients beyond today.
Yeah.
And they begin to see themselves not just as task performers, but as agents within the healthcare system. And the ICN student statement calls for planetary health to be embedded in nursing education from the beginning. And this is it must include like clinical reasoning, quality improvement, ethics, and also leadership. I think leadership is one of the ground foundations of making a more sustainable future, and making planetary health one of the big questions. And yeah, so we must change in clinical systems. So how do we go from individual motivation to system responsibility? So one of the risks we need to name openly is that we cannot place planetary health responsible solely on individual nurses. Early career nurses already navigate high workloads, moral distress, and staffing shortages. So the question becomes, how do systems support, not exploit, engagement? And from my perspective, this means linking sustainability to patient safety and quality, supporting team-based initiative rather than individual heroics, making sustainability visible in everyday practice, not just policy documents, and value in education or reflection time. So planetary health must be professional legitimate. You want to say something, Tim?
Yes.
Sorry.
Can you come to an end, because I want
I'm gonna come to an end,
conclude,
sorry.
and
Yeah,
maybe there is questions,
absolutely.
because I see there is one question already.
Okay, I will make fast. So, well, why this is important, I think both we have to work as nurses within our individual wards to actually have an impact, but also our nursing association has a vital role in actually affecting policymakers and making a difference in the big picture. So yeah. So that's to just, and if we want nurses to lead sustainability, our professional organization must lead courageously and making planetary health visible and legitimate and doable for every member. And I think that's the main issue, but also the main solution. Yeah, so that's what I have to say. Thank you.
Thank you. Before I conclude and give the takeaway messages that you gave, maybe you want to share with us quickly to your experience with your network, stories that you learned from your colleagues, students about public health and community and public health. Do you have something to tell?
Like within can you ask the question again? Sorry.
Yeah, through your networks, you're speaking with nursing students and early career nurses. Do you have any interesting stories about community and public health from them?
I think one of the stories I have is that that I don't really have maybe a good story. I think it's in Sweden or in Sweden, it's kind of I think we kind of not see the big effects right now. And I think that's one of the main issues for us. And therefore also in the public health, even if we don't have the resources, but I feel like from my network, the main issue in implementing and working with planetary health is the lack of time and resources and other alternatives, which is kind of the government who is responsible for. And I feel like that is one of the most, we could have worked more sustainable within like the community health.
Thank you. Francisco, quickly.
Uh, for me, I was thinking in terms of planetary health, I gave my example, okay? And when it comes to other colleagues and working with other colleagues regarding public health, I think it's the message that I sent in my presentation that we should work and all the stories that I have, and Tim, you know some of them, um, are based in trust and are based in um, supporting one another. Okay, if nursing and our science wants to be related, and of course it's related to public health, but if we want to be in this kind of discussions, we have all to go in the same direction. Okay, so that's just the message that I've sent, not a particularly um,
And
um,
and
episode.
actually, it's quite a strong message, and you know that I truly support in this Nurses of the World Unite message, and I think Marlene is also supporting this message. And you talked a lot from your experience, Marlene and Francisco, and like from what I heard, it all starts from our cause of planetary health and public health. It starts from the education, and what I heard, not between the line, your clear message that the nursing curriculum needs to change and to be updated to modern days problems like planetary health and planetary related health problems, and it needs to be also done quite quickly. Also, nurses on the wards and nurses in the communities needs to take their leadership roles and bring it to the table, these problems, these planetary health problems, and that we actually need to bring it to the table because nurses most of the time put on the side and not really heard. And the leadership part is really important to bring this issue to the table because we are always there. Um, and again, if I will summarize it, um, we need to organize ourselves in groups, in association, in order that our voice will be heard and strong. I want to thank you really from the heart to Marlene and Francisco for being with us today. I haven't seen any other questions on here. Do we have any questions from the audience there? Something less, something that you want to say? And no need to be sorry, Marlene. All, all okay. And I thank you all for being in this session. Thank you, Francisco. Thank you, Marlena. Thank you for the Nightingale Foundation for inviting us to speak. And if you want to connect, there is on the website the details of Marlene and Francisco. And thank you for being with us today and supporting this really important cause.